Can lupus medications increase the risk of infection? This is a question that many people living with lupus may wonder about. The short answer is yes, certain medications used to treat lupus can indeed increase the risk of infections. This happens mainly because many of these treatments work by suppressing or altering the immune system. In lupus, the immune system already behaves abnormally, attacking the body's own tissues. To manage this, doctors often prescribe medications that reduce immune activity. One common type of medication is glucocorticoids, also known as steroids. These powerful anti-inflammatory drugs are frequently used in lupus treatment. However, long-term use of glucocorticoids can significantly raise the risk of infections. This is because they broadly suppress the immune response, making it harder for the body to fight off infections. Another group of medications are immunosuppressive agents. These include drugs like methotrexate, azathioprine, and mycophenolate mofetil. They are often prescribed when steroids or hydroxychloroquine alone do not provide enough control over the disease. These medications work by reducing the activity and growth of immune cells, which can further impair the body's ability to combat infections. Biologic agents, such as belimumab or anifrolumab, are newer treatments that target specific immune pathways. While they are generally more targeted, they can still increase the risk of infections, especially with long-term use. On a more positive note, hydroxychloroquine is a cornerstone medication for lupus that is generally considered safe. It has a lower risk of causing infections compared to other treatments. Hydroxychloroquine modulates immune activity without broadly suppressing it and may even help reduce some complications related to lupus. When taken as prescribed and monitored regularly, it does not significantly increase the risk of infection. The overall risk of infection for lupus patients can vary based on the type of medication, the dosage, and the duration of treatment. Higher doses and longer treatment periods, particularly with glucocorticoids, are linked to a greater risk of infection. For those managing lupus, it is essential to have regular checkups with healthcare providers. This helps balance disease control with minimizing the risk of infections. It is also important to report any signs of infection, such as fever or unusual symptoms, promptly. Preventive measures, including vaccinations and practicing good hygiene, are crucial. Patients should avoid stopping medications abruptly without medical guidance, as uncontrolled lupus can also lead to a higher risk of infections. In conclusion, while lupus medications are vital for managing the disease and preventing damage to organs, many do increase the risk of infections due to their immune-suppressing effects. Hydroxychloroquine stands out as an exception with a safer profile. Working closely with healthcare teams is important for effectively managing these risks through careful medication management and monitoring.